The pandemic has, of course, put a huge strain on the NHS and resources prioritised to tackle people dying from COVID. But that, of course, means that waiting lists for other kinds of treatment have grown, from cancer care to mental health. So let's talk about this with the Shadow Health Secretary, Jonathan Ashworth, who joins us from Leicester. By prioritising COVID, have we taken our eye off the ball when it comes to other important health conditions?
Well, it's understandable as to why we had to prioritise COVID, because, to be frank, if you underfund your NHS over many years, if you cut beds, if you try and run your NHS with vacancies for 100,000 staff, and you cut training, you cut public health, you cut social care, that means when a crisis like this hits, you're more exposed and vulnerable. But we shouldn't have to make a choice between COVID care and cancer care. But that's what we've been doing, and today we're missing all the targets, or the main targets for cancer care. We've got a huge backlog in our waiting list, over 300,000 people now waiting beyond 12 months for treatment. It was 1,600 a year ago. This is risking loss of livelihoods and permanent disability. For some, it's risking loss of life. So we're saying to the government, we need an NHS rescue package. We need a plan to put the funding into the NHS. But crucially, we need a plan now to recruit the staff that we're going to need for the future to deliver the quality care that patients deserve.
Now, we've been talking a lot about COVID and, of course, the Coronavirus Act later on this week that everyone's going to be voting on. Steve Baker earlier on the programme said that Labour would vote for any old authoritarian measures, so he expects you to vote in favour of extending the Act for another 6 months. Is he right?
Well, I don't agree with the way he's characterised it. And, of course, he voted, and lots of Conservative MPs voted for lots of authoritarian measures last week in the House of Commons. Look, whether we like it or not, the virus is still circulating. We've got around 6,000 infections a day. That is a high level of virus circulating. It's much less than where we have been, obviously, but it's still quite dangerous out there. So yes, vaccination is rolling ahead and is succeeding, but we still have to be cautious. We still have to proceed carefully. We have to be driven by the data, and that will mean, I'm afraid, that governments will have to have the powers to impose restrictions where necessary. So there are bits of that Act which need to be properly scrutinised and haven't actually been implemented. And I'm going to be asking Matt Hancock why certain elements of that Act around social care, continuing health care, need to remain on the statute book. But there's other elements in that Act which I believe are needed. Governments do need to be able to impose restrictions. Governments do need to pay statutory sick pay from day one. I'd actually like them to go further and pay more sick pay. And governments do need to stop people being evicted from their homes if they can't pay the rent because of their livelihoods have been so hit by this pandemic. So it's a complex piece of legislation.
You'll be voting in favour, though?
It's a complex piece of legislation. We broadly support it. It ought to be properly scrutinised. I mean, I think what is frustrating is that Steve Baker, who I have tremendous respect for, should be given the opportunity to put forward amendments to the Act. But the way in which the government timetable these deliberations means he's denied that opportunity. This Act was emergency legislation a year ago. It should be properly scrutinised now. And if Steve Baker and Graham Brady wants to work with us to get the House of Commons to agree a proper process to thoroughly scrutinise that Act so we can all put forward amendments, I'd be happy to sit down with him tomorrow to see if we can find that procedure.
You're clearly concerned about the way ahead. You say that we shouldn't take our foot off the pedal, if you like. And there are rising cases in Europe as well. What is your position on summer holidays? Are they something that needs to be sacrificed in order to keep cases low here?
Well, I've always said we have to proceed with caution. We have to study the data at every stage. Because sadly, and I don't want to disappoint the viewers, but just vaccination in the whole of the United Kingdom, while important and will save lives, does not make us bulletproof. It does not make us completely safe. We are only safe when everybody is safe. So long as the virus appears to be surging in France, in Germany and parts of Europe, which it is at the moment because this is their B117 wave. That's the Kent variant. That we've had our Kent variant wave, if you like. Their Kent variant wave is now surging. So We are not safe while the virus circulates in these huge numbers across the world. And of course, we run the risk that more variants, more mutations emerge, which bounce back and hit us and potentially evade the vaccine success that we have had. So it's a long way to answer your question, is that it's too early to make a judgment around the May 17th date on international travel, I would argue. I'm not expecting myself to go on a holiday abroad this summer, but we'll obviously keep these things under review, and we have to continue to do all we can to squash the infections down and protect the success of vaccination here in the United Kingdom.
Well, after speaking to you and Ben Wallace this morning, it does feel like maybe holding back on booking that foreign holiday might be a good move. Just finally, while I have you, Labour have selected the former MP Paul Williams to fight the Hartlepool by-election. He was on an all-male, all-white shortlist of one. In the Labour Party, is everyone a feminist until it doesn't suit you anymore?
Say that again. Sorry, say that again, sorry.
In the Labour Party, is everyone a feminist as long as it suits you and then stops?
Well, we're still committed to all-women shortlists and improving the representation of women in Parliament. We've actually got more than 50%, I think, of women in the Parliamentary Labour Party because of all-women shortlists, and we're very proud of that, and we will continue to use all-women shortlists in parliamentary selections and in future by-election selections.
Just not this one?
Well, I wasn't involved in this. I mean, I'm not on the Labour NEC who takes these decisions. I'm pretty busy dealing with our COVID response, to be honest. But we will use all women shortlists in other parliamentary selections. I've got absolutely no doubt of that.
OK, Jonathan Ashworth, thank you very much for being on the programme this morning. Thank you.